So I have the distinct honor and to serve as your moderator this morning, but please allow me to introduce our esteemed panelists. We'll start with Dr. Arlinda Ellison. She is a public health and holistic health educator, coach, researcher, and facilitator. She is also an adjunct faculty member at Legacy Holistic Health Institute. She has 20 years of experience in public health education and community-engaged research. We also have Dr. Chris Heaney. Dr. Heaney's research focuses on the impacts of public land use, waste management, food production practices on health and well-being. He is the founding director of the Community Science and Innovation for Environmental Justice Initiative at Johns Hopkins Center for a Livable Future. And then we also have, lastly, Dr. Virginia Guidry. She is the North Carolina Department of Health and Human Services Environmental Justice Justice Lead and the director of NC Wastewater Monitoring Network. She has worked on environmental health and justice issues in North Carolina since 2003, including experience in community-based research, communications, and applied epidemiology. Welcome to the stage. How are y'all feeling tonight? I just felt like saying tonight. You have to say that for tonight. You can't say it this morning. Great. And I want to recognize Ms. June Blotnick is here. She's actually right there. She actually got me involved with Clean Air NC. I know she's going to be acknowledged later, but I wouldn't be here today without her. So thank you, June. I appreciate that. Welcome. All right. So thank you, Dr. Guidry, Dr. Ellison, and Dr. Heaney for joining us today. What an amazing panel we have. This is an amazing opportunity to engage in conversation today with these change agents, because that's what they are, and they value community voices. So I'm thrilled to talk with them about that. So one thing's for sure is that you all are no stranger to each other. You've done a lot of work together. But while we know that community work is highly effective, policy is the systemic change we need to reinforce your work in the community. So this leads us to our first question. Well, we'll skip around. We'll start first. What is health equity? Let's start there. What does health equity mean to you? We'll start with Dr. Ellison. What does health equity mean to you? Take your time. It's a very loaded question.
It's a loaded question. I think for me, to just kind of wrap it up nicely, it would be free and open access to all the social determinants of health. When we think about those social determinants of health, access to health and health care, built environments, education, safe housing, safe communities, safe food access, safe foods, clean air, clean water, all those different things, it is free access to that, because equity in itself is that really that fair access to things you need. Well, we need all of those things. So for me, I would sum it up like that.
Dr. Guidry?
Good morning, everyone. For me, health equity refers to having equal access to a clean environment, which contributes to everyone's health, similar to what Dr. Ellison was just saying. I'll tell you a quick story. I was at a community meeting down in Pender County a few weeks ago, and it ended late, and so I was driving back at night. And I was driving through Duplin County and Sampson County and others along I-40. And probably for 40 miles along I-40, the air smelled awful. And my background is in epidemiology and environmental justice research, and I had studied the community health effects of industrial livestock operations out in eastern North Carolina. So I knew what I was smelling. And I just kept thinking about all of the people living there and those who are most impacted by that. And when I got home to Chapel Hill, I got out of the car and I took a deep breath, and guess what? It didn't smell bad where I live. And to me, that is just one of many, many examples about the differences in the places where we live, where we work, where we play, where we pray, and how those differences affect our health. And we really need to work towards equity between those places. And we know that that doesn't exist right now, and that's one of the things we're talking about here today. So thank you all for having me.
Great, yeah. Dr. Heaney?
Good morning, everyone. Just to build off of what Dr. Guidry and Ellison both said, is the idea of, for me, thinking about the difference between equity and equality is you really need to think about the structural factors, which are either providing equal access or lack thereof. And so health equity, I think we have to start at, particularly with what Virginia was mentioning, is thinking about the structures that produce environments for communities. And are we spending time with communities, and are we educated on the lived experiences of what it is like to live in communities that have different environments from where we may live? And so for me, health equity needs to recognize the starting point to try to achieve the goal of health equity through the environments is really, conferences like this are great, but just spending our time with the communities at the front line and fence line and building the movement with them, spending time to listen to what the needs are, what the concerns are, and trying to think about the scientific or legal, advocacy, policy, civic engagement, political power building that's needed to begin to allow everyone to achieve the full extent of health, not just the absence of disease, but thinking about how do we get to the point where everyone can walk out their door, have a lack of malodor, no smells, and the structural features of the places where we live that can support the full achievement of health. So I think that's a big difference.
That's excellent. And as you notice, there's a theme here. They all value community. So I want to unpack something you said, particularly Dr. Heaney. You all can jump in afterward. But you mentioned frontline communities, frontline voices. But why is there still a struggle to actually view community as experts constantly? Because you all do, but a lot of people do not, or they don't value their time. So in your experience, why do you think that is part of the systemic solution? Because that is the solution. So I would love your thoughts on that topic.
So I think we've made great strides in that regard. To the point of their examples at the federal level, the National Institutes of Health have embraced frameworks and principles, operating principles for research that are community-based, participatory research, which elevate the expertise so that if you're sitting around a table or conference with tables where you have a panel of experts, that it absolutely should, by requirement, include community residents who are living with the problems every day. I mean, we have, a phrase by Omega Wilson, if community have been living with the problem, they've been owning the problem for decades, if not hundreds, if we've heard with the land acknowledgement. So why should they not be a part of managing the process for solutions and be a part of driving the solution? So I think we've made some strides, but it's nice to see that if you think of a continuum where traditional medical training involves testing a hypothesis through an experiment. The experimental design, we can randomize features, right? Remove all those biases. Sort of shifting from that continuum where you could test any idea in any setting, be it in a lab or out in a community or out in a population, down the continuum where you're thinking about community participation and saying, what should the research question be? Where should we be looking? What times of day should we be paying attention to certain things if it's environmental features in order to get it right? So I think we're moving in the right direction where expertise and the voices of community are experts, and it's even the farthest down the continuum, I would argue, is community-owned and managed research, which Omega Wilson is the architect of, where it's the community that's provided with, be it NIH or EPA or Centers for Disease Control and research funding, and they're able to drive the bus and invite the experts onto the bus who they really see share their vision. And it's a big development because it sort of short circuits the idea that participation of the residents who may be affected by the environmental concerns could somehow bias that sort of very traditional experimental control everything, have the treatment groups be very compliant in the research process, right? It's sort of flipping it on its head, and I'm really refreshed to see that there's been a lot of movement down that continuum.
And I'd love to hear, thank you, Dr. Heaney, that was fantastic, because we know you value community-based participatory research. Dr. Ellison, you were one of the first to lead a county to incorporate racial disparities, and you really center frontline communities, particularly with your environmental justice assessment, the first one to do that. I know Dr. Guidry was part of that process. I would love to hear your thoughts as well on the question.
Yeah, actually, I think the way you brought the question out was very, very much accurate. The community oftentimes are not asked about the problem, but they are the PhDs of their community. And I think part of the problem is that we have this thing of the experts, you know, we know what's best for your community type approach, and we know that that is not the way to go. To your point about me using that approach in the community health assessment in my county, and I think we'll probably get more into that conversation. Every county in North Carolina has to do a community health assessment about every 3 to 4 years. And so what our most recent assessment, what we did, actually through the help of Dr. Dixon, through Dr. Stephanie Baker at Elon University, they connected us with Omega and Brenda Wilson, who are the co-founders of West End Revitalization Association that you will hear a little later in the afternoon. And they are really some of the leaders in that area around environmental justice and just bringing that information to the forefront. I had already, in my background, partnered with communities, so it wasn't a new thing for me to partner with communities and make sure that communities are at the center of what the work is. But to add in environmental justice was brand new. I had no idea that no other county had done it. We were just really stepping out there. I had noticed that Durham County had done a section on climate change in their previous assessment, and with the addition and the help of West End Revitalization Association, was like, okay, hey, here's an opportunity. There were some things happening in the county. I'm in Alamance County. There were some things happening in the county in terms of some environmental justice issues, one being the Western Electric plant that had been sitting empty for 30 years. This used to be a place in the 1940s where they built warheads, and then it turned into Western Electric, an electric plant. So you can imagine all the things that are there in the ground and so forth. And an article had just been written by NC Policy Watch. I don't know if Lisa's here already. Yeah, an article had already been written by NC Policy Watch. And it really started a conversation about what was happening with the people that lived in the immediate proximity of this building. And so we said, this is our opportunity. We can talk about this now, because this is a fairly conservative county. You know, you have to play the game, okay? So, but this really gave us an opening. And then also the fact that this is public health. This is public health. And for far too long, I think it's been separated. The environmental piece has been separated from everything. And so this was our opportunity to jump into it. We had not, in addition to Omega and Brenda and their organization, we also had a health equity collective, which was made up of about 70 community members. and very diverse groups. So really to get feedback on what we were doing, and with the work with Omega and Brenda, we created an entire chapter on environmental justice, and it was mainly based on the work that they had been doing. So this is a beginning for us, and actually now this helps us to take it to the next step. And it's gotten a lot of attention, and some not so good, if I'm honest. Because when you make people uncomfortable, they tend to push back. And there's been some pushback. And I've kind of been hanging out there, getting hit by the pushback. But thankfully, I've had good support. And we're going to continue on. And I'm going to keep working with Omega and Brenda and their organization. And hopefully we can grow this and continue on.
And just to we're doing at the state level is lifting up that example and trying to promote that to other counties. And so when we learned of those efforts, and I wasn't part of the initial chapter, but I'm trying to help promote that to other counties, because at the state level, we have to think about our role statewide and what can we do across the state. And how do we lift up those community voices? And so we have an effort right now that's led by one of my colleagues, Joe Bowman, and he's reaching out to different local health departments about their community health assessments to try to encourage them to include environmental justice. And he's getting some good traction on that. So our goal is to have at least 10 local health departments include environmental justice chapters in their community health assessments in the next cycle. And they're done on a 3 to 4 year cycle, depending on the county. So that's what we're currently working on. So we're lifting that example up and trying to help other people have the resources and connections to do that. One of the goals of that is to help the counties connect with community-based organizations if they need to. So I know Joe has been talking with, of course, also Omega Wilson, as mentioned, also the North Carolina Environmental Justice Network and others about helping to build those community partnerships to inform the community health assessments around environmental justice.
That's fantastic. Thank you both for those responses. And I would say, Dr. Guidry, you've been quite a trailblazer as it relates to ensuring health equity and the language of disparities is included in executive orders. And so I want to transition a bit to the next question, because you all, it was very well said, but what role and responsibility, and it's a bit of a segue, do state and local health departments have in addressing and including environmental justice in their community health assessment? Now, community health assessment process, Dr. Ellison, you've kind of addressed that. You could certainly add to that. But I'd love to hear from Dr. Heaney your thoughts about that question.
I think what the expertise in that specific area about how community health assessments are performed is obviously here to my left. But one of the things that strikes me about the impact or potentially lack thereof is the ability of those community neighborhood PhD voices about, I think there is something wrong here in my neighborhood or in this part of town, be it this block, to be having that support, because you need that backstopping support. So I think one of the things that would be really important to think about would be to bring, and this goes back to the first question about health equity, needing to have a disproportionate investment in the backstopping of a lot of the narratives that could go into an environmental justice chapter, which I believe would require assistance, technical assistance, help capacity, which typically governments might hire and issue a public announcement for a subcontract to like an environmental consulting firm, which there are many of, which they might put a lot of resources behind, hundreds of thousands of dollars, for them to do any kind of lab testing or an environmental impact assessment. But really, we need to be thinking about investment in the community concerns and shift our definition of the client. The client is not, developer XYZ, industry XYZ who wants to speculate or develop a plot of land and have the town or the city or entity be a partner in the development process. But we need to think about investments to get that information for the community voices, which have probably been saying these things for decades and going to public meetings for decades. But now if we can formalize it very nicely on an administrative way through environmental justice sections of a community health assessment, that could form a legal framework which could help support, but I see a big need for scientific technical support. That would mean, things that could summarize the state of water quality, the history of land uses, and the potential impacts for water, soil, sediment, air, et cetera. So I think that could be a really big need moving forward.
And so, Dr. Guidry, I hear you. I'm not sure if my mic is on. Okay, I hear you saying putting the community voices as experts in those positions of power to make an impact on consulting or things of that nature. I'm hearing you trying to shift that narrative to say they also should be in those spaces. I hope that's what you were alluding to a bit. Yes, okay, all right. So I just wanted to make sure I lifted that up. I wanted to give Dr. Guidry an opportunity as well to speak, and Dr. Ellison as well.
Yeah, I'll just, come back to that issue of, you had mentioned the executive orders, and, to me, that we need to look for any opportunities we have to promote environmental health and environmental justice. And being in state government, one of those opportunities is executive orders. And so as Governor Cooper has gotten to start focusing on various environmental issues and environmental justice issues, I have been working hard to get health inserted into those executive orders whenever it's applicable. And so there have been a couple, starting with Executive Order 246, where we really inserted a paragraph on health and health equity there. And then going forward, there's been additional ones. 271 was about air pollution and medium and heavy-duty vehicles, and we also made some commitments in that executive order. So that is a tool. I know it doesn't solve all the problems, but it puts us on the record. It makes us accountable. I know many in this room are very good at holding me accountable to the things that we're saying. And that's what I'm trying to do in my role there at the state, is to build that accountability and put things on paper that we're committed to there. And so that's an important role of the executive orders to me.
I will just add to something Dr. Heaney mentioned in terms of the community. Actually, you're right. They've already been talking about certain things. I know recently, when we were doing, there was people coming to the commissioners meeting complaining about a rock quarry that was supposed to be getting built in their community, in their neighborhood. And I'll just tell you, this was in the southern part of the county, and there were mainly more white people coming to the commissioners meeting because it affected them. And the difference between, for instance, Western Electric, which is in a predominantly Black, Latinx, low-income area, and the attention is a little bit different. To be honest, the attention is a little bit different, just to put that out there. And so, yes, the community has already been talking about it, but I don't think that the voices that really need to hear it and take it seriously are willing to take it seriously. I will also add that in terms of our role, the local health department's role in including this in the health assessment, I think we've started out at a baseline, I would say. So we need what you just named, but for many counties who don't have that capacity, and they don't have that capacity, it's just starting out in the beginning of this is what is happening in the community. It's already out there. We just need to, as Dr. Guidry just mentioned, put it there on paper. It's a formal document now. And that's helping us to kind of push the envelope, and keeping in mind working with those community members. So I, again, working with West End, with Omega and Brenda, and you're just going to hear this name a lot today, but working with them, I'm in a boss, anybody that works for government, local government, you know you have some boundaries, some parameters. I mean, I'm sitting beside the state right now. So you have some parameters of how far you can go. But your community members have a little bit more latitude. They can go a little bit further. They can push a little bit harder. And so together, we can make a greater impact because it's using both of those sides, you know, the policy, the government side, along with the community. And the community gets loud enough, eventually, their voices will be heard. But it's a constant push. Again, West End has been doing this for 30 years. You know, I'm brand new to this. I'm new to this in terms of this level. I'm new to this, so yeah, we just keep pushing.
Just to build on that for a second, I think it's also really helpful to us in government when we need to respond to something. So Dr. Ellison talked about the article about Western Electric and providing an opportunity to respond. And I would say the same thing for us in state government. When there is enough attention brought to something, then we can respond. We can say, look at these news articles. We need to do something about this. Look at all the attention we're getting about this. We need to do something about it. And I would say the same, coming back to the research idea, when a research study comes out, especially when it was conducted in North Carolina and involves communities in North Carolina, that gives us something that we have to respond to. And we can, you know, say, look, we're doing this because of this study that came out. And it's really valuable to have those inputs to help us, you know, be able to take action in the governmental level.
That's such a powerful point that you both have made. I think oftentimes institutions are given a bad rep, understandably, but when you have people like you all who may be in institutions who are actually saying, I need your help, there's hope. And we really appreciate that. And I would love to segue to the next question because, Dr. Guidry, you mentioned research. So the third question we have is, how can research institutions, local health departments, and community-serving agencies such as nonprofits or community-based organizations be more intentional in collaborating with each other to advance shared goals of health equity? You all kind of addressed a little bit of that. But how might we be intentional? I know Omega Wilson, we're going to say his name again. I see him right there. He's been fantastic in being intentional in collaborating across all sectors, but he's also learned how to navigate within the political space without losing his foundation at the same time. So I'd love to hear your thoughts about how can we be more intentional about collaborating on health equity. We can start with Dr. Heaney.
So I think maybe the picture that's emerging is sort of the complement, how these spaces have pieces that need to complement each other. And I think for the space that I can speak to mostly would be the research sector coming from an academic institution. And I really see a key role with what's developing here around discussions at the statewide level with the community health assessments to try to grow that. And a potential for existing and potentially new executive orders supporting environmental justice goals at the statewide level. I really think academic institutions and researchers need to be doing community-driven research, need to be doing community, true, authentic community partnership research that is not, you know, thinking of research questions that matter from searches on, PubMed, but actually thinking what are the real knowledge gaps in communities and spaces, places where there haven't been people wanting to look or answer. In fact, probably deliberately have not been going to those places, spaces to look and answer questions because it could have some economic benefit for them, right? And so really, I think one of the big things in the theme around health equity and the environment has to do with land and the ability to develop, right? And Omega taught me this as a neophyte kindergartner, as he says in grad school. But it has the pushback is that, we need really rigorous science, the most innovative, rigorous science backstopping the community questions in order to counter the typical science that can be procured by whatever other countervailing force there is to try to have an alternative vision for development of the environment, manipulation of the environment. So I really think we have a fun job, we have a good job as academics because we get to spend time in communities and we get to learn how to do science that responds to community-identified needs related to environmental health, justice, burdens. And it strikes me that from sort of academic institutions, higher levels, graduate schools, I come from Johns Hopkins, but even all the way down, if you think about community-driven research, it connects, and you can connect all the way down to the local communities, you can connect into local schools with community science in the home, and you can really grow a big movement with bigger data. It's just that you're not, answering the questions of, say, some NIH priority for, some institute which sort of has the siloed structure. You're really addressing and saying, is it a community environmental justice concern? Yes. Okay, then we're going to spend an intensive amount of resources, time, and energy to try to investigate it. And so we've seen opportunities where that can be from the halls of academia, directly working and trying to advance those goals to explicitly build power in the communities to change things, but it also allows you to connect into community science at lower levels of education, primary high schools down into middle and elementary schools as well.
So wait a minute. Wait a minute, Dr. Heaney. You mean to tell me we're not only here in the institutions to publish our publications and stay in the ivory tower and get tenure? Are you sure? I mean, that's what they've trained us to.
I think
Okay.
Crystal, you mentioned Jeannie Ng, right? You know Jeannie Ng at UNC. She recently retired, and so I had the opportunity to train with her through the Kellogg Scholars Program. I was at the UNC, but it was the whole nut to crack is how can you do authentic community participatory research, community action research, and still, it takes time to do it right, and it's slow to still do that in an academic form, and it's challenging for sure. But I think with the community science movement meeting up with, academic science, I think there are other ways to sort of do that in an academic space, but also be authentic and real and not sort of, the cliched ivory tower, basically.
Thank you, Dr. Heaney. Dr. Ellison or Dr. Guidry, would you like to add?
Yeah, I would say the best way for us to be intentional is to be intentional. And what I mean by that is there are people in communities, there are groups, there are organizations who most likely are already doing the work. They're already talking about it. So it is coming to them, may I join you? May I add my expertise to you? Not take over, but, may I join you? Can you please tell me about your community? Not me tell you what I see is wrong with your community. Just be very intentional about joining with the community and leveraging what that means, and not making the community, this is not a dig, let me just preface this. The community, is not down. It's not the ivory tower and then down to the community. Leverage it. Treat the community as if they are the experts that they really are. Pay them for their time, whether that be financial or whatever that is. Pay them for their time and make them a part of the process. My first experience with community research actually was with UNC, Jeannie Ng, Dr. Giselle Corby, all of them. And there was a study where they hired us as community experts. And at that time, we were talking about HIV prevention in Eastern North Carolina, because at the time I was in Eastern North Carolina. And so it needs to be things like that, really working with the community, leveraging that, and being intentional about it, and understanding that it's not going to happen overnight. This is long haul. This is marathon. And I think if we commit to that, then we're going to start seeing more things take place.
And I would just add, I think that's one of the reasons meetings like this are so important, right? Because we can get to know each other and build partnerships before the opportunities come along, and then when they come along, we can build on those partnerships. I'll give you an example. I had been talking with folks about, what gaps are persisting in different parts of the state, and what I kept hearing was private well treatment and private well testing. And because private well owners are responsible in North Carolina for their own testing and treatment. There's no state programs for that. And that can cost different amounts in different counties. The county health department sets the rate. And then the treatment can be expensive as well. So one of the things that we just recently did in partnership with the Environmental Justice Community Action Network is put in a proposal to help put in treatment systems when homes are tested in eastern North Carolina and they find that their wells are, contaminated with various contaminants. Will help to provide the treatment systems if we get the funding to do that. But that's because we had those conversations. We knew that there was that gap, and then an opportunity came up, and we did our best to jump on it. We'll see what happens there. But
And I appreciate you mentioning that example, Dr. Guidry, because what she just described was a systemic solution. It wasn't giving you gas cards to get to the hospital. While that's important, she was getting to a structural inequity and solved it, right? And there's probably other implications related to that water getting access to that contaminated water. But the way these change agents are thinking is how we all should continue to think. And you all are here because you likely are thinking that way, but a lot of people are not. And so this has been amazing so far. One last question for you all. You're out of the hot seat soon. But what is one message you would like to share with health professionals and students, because some are here as well, interested in getting involved with environmental justice work? You can say professionals and or students, whoever you'd like to address. And we'll start with Dr. Ellison.
Okay. What is one message? There's a lot of work to be done. There is a place for everyone. So for students, if you think you may be interested, pursue that interest, explore it. There is so much out here that we can focus on. You don't have to worry about duplicating someone else's efforts, because chances are we still need your expertise also. And also be confident in that you do have a level of expertise right now, and continue to build on that. And then there are many people who are already in the field who are ready, willing, and able to work with you.
Thank you. How about Dr. Heaney?
I would say just having really a good sense of humility, and recognizing what skills, capacities you might possess when you attend a meeting with a community group to try to learn about the problems that they're facing, to be aware of those things that you could bring to the table, but having a good sense of humility and a recognition that maybe building off what you said, Dr. Ellison, is sort of to walk a path together, or even to take a step back and allow the community to lead. And actually, I would argue that's critical. And then trying to weave yourself into that fabric and build something that acknowledges the position, the history, the structural environmental racism that's been being trying to be unwoven. And so I think really it takes just an incredible amount of patience and humility. And I would also argue it requires a readiness in a way to when the conditions call for action, that really you move together. And so if you sort of practice that humility and listening, and really building that relationship of trust with community. I think when the time comes for needed action to build power around particular policy decisions or to inform things, I think I've seen it work quite well. And I think that's sort of I think that advice applies from every level of work that we've done as students early on and then up through more professional settings.
And I would just say there's a lot of momentum around environmental justice right now, and we need to catch that wave and make the most of it. There are funding opportunities, there is support for environmental justice action at different levels, and we just have to all work together. You know, we've mentioned a couple times the complementary roles. If research is your thing, great. Do research that will support environmental justice. If you want to be in public health practice, great. Look for health department mentors that can help you do public health practice. If you want to be in a community organization, fantastic. Do that and play that role. There's so many different roles that people can play and help to promote environmental justice in different ways. And now is the time. We have, like I mentioned, momentum around it. We have a climate crisis looking us right in the face, and we need to take action now.
Excellent. Well, there you have it, intentionality, humility, and momentum. You all here are your change agents, and thank you so much. We're going to go into possibly our Q&A. No? All right. Please give our panel a round of applause. Thank you so much.